I completed a case study on the topic of encopresis. In the study, a 4-year-old African American male presented to his pediatrician with complaints that were consistent with this diagnosis. This video would demonstrate the brief intervention that occurred following the referral from the primary care physician to the BCP. The child and his parents are present. The presentation of this brief intervention will start with psychoeducation regarding the disorder and then lead into normalizing things for the child as well as for the parents, and will then transition a bit into discussing common symptoms and signs associated with encopresis, such as anxiety, low self-esteem, self-blame, and depression. The identified patient's name is Michael Marvel. His parents, Mr. and Mrs. Marvel, are present as well. Hi, everyone. How are you this evening?
Good.
Good. Michael, it's great to meet you. How old are you?
4.
All right. Good deal. Why don't you have a seat, Michael? So thank you, everyone, for taking the time to come. I want to give you some ideas of what encopresis is. I know that encopresis is a big word, and I'm not sure if Dr. Kincaid had a chance to actually explain it to you. But encopresis is just the random and uncontrollable discharge of fecal matter. It happens sometimes in underwear, or it can happen in socially unacceptable places, maybe at school or in the park. And it's for children who are between the ages of 5 and 15 years of age, and the child must have been previously potty trained or have achieved the ability to properly manage and effectively control his or her bladder. Okay, in order for a diagnosis of encopresis to be set, all of those things have to be put in place. Okay, so I want to talk about some of the signs and symptoms that you may have been experiencing, Michael. Okay, so do you sometimes have a hard time going to the bathroom?
Yes, ma'am.
And mom and dad, do you notice that the time periods in between his bowel movements are long? He may have a bowel movement one day and may not have another one for another couple of weeks or maybe even a month or longer. Yeah. Other things that we've noticed with encopresis is the leakage in the underwear, which sometimes parents may mistakenly identify it as something related to diarrhea. And in fact, what happens is they have so much backed up stool, and the stool that is able to go around the clogged up stool is the leakage. Okay, so you see that sometimes. The constipation with the dry and hard stool, the unexplainable complaints of pain in the rectum or near the rectum or colon area. And sometimes, Michael, do you try to just not go to the bathroom because you're afraid it might hurt if you try?
Yes, ma'am.
That's also something associated with encopresis that we see a lot. But Mr. and Mrs. Marvel, when he actually does go and he's actually able to have a bowel movement, do you ever notice that it's an excessive amount of stool in the toilet and it may actually clog your toilet sometimes? Yes, that's exactly what happens. So, Michael, your dad told me that sometimes you feel a bit anxious. And he explained that to me as you having trouble, with breathing, and sometimes you have the sweaty palms. But won't you tell me what you feel whenever you feel anxious?
I feel like my stomach starts to hurt a bit more, and then I have trouble breathing. Sometimes I cry really bad because I become afraid something bad or embarrassing is going to happen to me.
Absolutely. Those are definitely right along the lines of anxiety. And what I would love to do with you and your parents is kind of give you some ways, some techniques that you can use to help to address some of those fears and address some of those symptoms of anxiety. Okay, so let's try this. Michael, come have a seat for me. So let's start with identifying some signs, identifying some techniques, some evidence-based strategies that you can use whenever you feel anxious. Can you think of anything that might help you to calm down when you feel nervous or anxious?
Deep breathing.
Oh, deep breathing. Good. Let's try that. Let's try it again. Another deep breath in. Very good. Very good. What else could you try?
Close my eyes and count backwards slowly.
Okay, good. Anything else?
Say good things to myself, like it's going to be Okay.
Wonderful. Self-affirmation statements. I love it. I love it. Absolutely. So those things can help you to calm down whenever you feel anxious. So whenever we do that, we can start to feel you should be able to start to feel yourself. And maybe sometimes when your heart beats fast, you can feel yourself calming down. Okay, so Mom and Dad, one thing I want to let you know is there's this book called The Ins and Outs of Poop, A Guide to Treating Childhood Constipation, and that's by Dr. Thomas Duhem. I would love for you to have a copy of this. You can go home and review it. It tells you about the different signs and symptoms of encopresis, the excessive constipation, and it gives you some brief interventions that we can discuss at our next meeting as well. Okay, we have a copy of it at the front office, and I'd love for you to take a copy and review it. Next, I want to talk about those self-affirmation statements with you, Michael. Whenever you're thinking of ways to make yourself feel better, can you give me some ideas of what you might say?
I am still a wonderful kid.
Wonderful, right? That's a great self-affirmation statement. I am still a wonderful kid. Anything else?
It is not my fault.
Oh, right. That is very important. You're right. And this is something that goes on with the parents as well. Sometimes parents blame themselves. They think of something maybe they could have done differently. But encopresis is not something about bad parenting or bad decisions that we as parents have made. So I would love for you to take yourselves off the hook for that, Mr. and Mrs. Marvel. I don't want you beating yourselves up and blaming yourselves for this encopresis because it's not anything that you did. And Michael, you're right on target when you say it's not your fault. It's nothing you've done wrong. It's just that sometimes our bodies function differently. And sometimes we find ourselves blaming ourselves for things that kind of do different things within our bodies. But you're right, it's not your fault. Is there anything else you can think of as a self-affirmation statement?
My parents are not upset with me.
That's right.
They will always love me.
Very good. Mr. and Mrs. Marvel, did you hear that? It's important that Michael knows that, and that is very good, that he's right. You're not upset with him, and you will always love him. So I also want to think of ways to and discuss ways to help parents, because Michael's not in this alone. Whenever I review some of the material and literature that we've discussed previously in the case study, one of the big things we always talked about is self-care for the parents, and that is important. And one thing you can do whenever you're thinking about self-care is setting time aside for you. Okay, but whenever you're thinking about ways to help treat Michael and better prepare for it, one thing I would tell you is be prepared when you're going on different trips. Whether it's a small outing or an extended vacation, allow for additional time, additional restroom breaks, additional time in case he has an accident, or always have extra clothes just in case he does have that accident. Reward small steps of improvement along the way. Okay, avoid consequences. We don't want Michael to feel like it's his fault, so by avoiding consequences, we can diminish that feeling. Encourage Michael to try to go to the bathroom maybe 10 to 15 minutes after each meal. We don't want him to be stressed out about it, but we want him to know that it's important to continue to try. And then that will normalize it for him, and then that can also help to decrease some of the anxiety he feels. Also, it's very, very important for you to follow up with your PCP's recommendation as well as the dietitian's recommendations regarding decreasing the amount of dairy products that he intakes and increasing fiber and any other recommendations that they've given you. Lastly, but very importantly, Mr. and Mrs. Marvel, try to normalize things and minimize the amount of tension you're giving to this condition that Michael has in order to prevent any discomfort or resentment between him and his siblings. Okay? All right. I really appreciate y'all coming in this evening. I look forward to following up with you next week. If you have any questions between now and then, don't hesitate to ask. And please don't forget to stop by and get that book at the front office at the desk. Okay? Thank you. Have a nice evening, Michael.